have you all here and that we have the possibility to discuss today whether we can find a hospital that is wanting to do the double-blind studies on homeopathic treatment. Welcome, welcome, welcome. I'm very happy that I know you all, and I'm very happy that you talk to me, and maybe you could shortly introduce yourself to our community outside there. Who wants to begin?
Okay, ladies first. So I'm Martine Jus. I studied veterinary medicine before I studied homeopathy from my late husband, Dr. Mahendra Singh Jus. And I am the head of the Center for Classical Homeopathy, SHI, in Switzerland.
It's good to meet you. I've heard a lot about your husband. I've not met him personally, but I'm happy to see you.
I'm also very happy. So that's about me. Next one.
I think it goes with the age. I'm the oldest, so I'm specialist for internal medicine and internal intensive care medicine. And I have directed homeopathy about 45 years ago. And I'm very much interested in performing studies. And I'm very much keen to have a good relationship between conventional and homeopathic and or complementary medicine in Vienna, Austria.
Welcome.
Yeah, then I make the next. Yes, my name is Armin Kittl. I'm from Germany, from Munich, and I studied empirical research and psychology. And I'm a specialist in thinking outside of the box. I explored the subconsciousness during the last 25 years and made a lot of experiments outside the box. Yes, and so I hope that I can support you and your team with my thinking, which is different. Yes.
Wonderful.
I'm Neil Dougan, and along with Mariana Kanangiza, I've been hosting the summit, this online summit, and the partially helping with the Congress originally in German. I'm in Australia. I'm a native of New Zealand, and my background from a medical perspective is in consciousness. So I'm a PhD researcher in consciousness. And I've been working with all matters surrounding that, obviously, throughout my professional career as well. I'm a clinical hypnotherapist and so on as well. So that's me.
So I'm Rajan, and I'm a homeopathic practitioner since 40 years. I'm also a researcher and teacher of homeopathy, and I've authored many books. And I have seen very, very good results in my practice with homeopathy with many different kinds of, disease conditions. And I'm very eager to, create models of scientific research which can conclusively establish the efficiency of homeopathy rather than, my saying so or somebody else's saying so. And we are very open for very, scientific trials. And I think this is what this wonderful system needs, so that it's fully validated. And accusations such as it is placebo or it has no effect or there is no scientific proof, I want that, this is laid to rest once and for all. And it takes its true place as a healing science.
As it should do. Professor Dr. Frass, could you please talk about the studies you conducted on the University Clinic in Vienna?
I think 2 decades ago, I performed 2 studies at the intensive care unit. One was with septic patients, and we had a randomized double-blind placebo-controlled study. So patients, of course, received conventional treatment at the intensive care unit. And in addition, it was the patient could receive either homeopathy or placebo following an analysis, and remedies were available at the pharmacy of the hospital. So they could be delivered very quickly at this time. And there was an advantage in favor of homeopathy with regard to survival, and especially to long-term survival. I think in septic patients, it doesn't mean very much if you survive 25 versus 30 days. This may be significantly, but I think it's more effective to look to the long-term effect, and 180 days means much more. And the second study was on COPD patients with nicotine abuse. So in these patients, a major problem may be that after weaning from the respirator, patients may not be extubated, so the tube may not be removed because of profuse tracheal secretions. So I found out in a few cases that most of these patients had a very thick yellow secretion. So I used in many cases Kalium bichromicum, and this worked very well. So we did a routine clinical study. So this was not classical homeopathy, it was a routine study. So patients received either Kalium bichromicum or placebo. And we found out that the volume of secretions was significantly lower in the homeopathy group, and also the days to extubation and to dismission or dismissal from intensive care were much shorter in the homeopathy group. And considering that one day in an ICU costs at least 1,500 or 2,000 euro, I think it makes a lot of advantage. And in addition, the longer you are intubated, the higher is the incidence of pneumonia in these critical care patients. And the second group of studies I've done was with cancer patients. 15 years up to my retirement last year, I was heading an outpatient unit at additive homeopathy for cancer patients at the Medical University of Vienna. And we did one study comparing retrospectively patients with advanced stages of cancer. And surprisingly, the survival was much higher. So in the second study, we did an open, pragmatic study where we evaluated the quality of life in these patients with homeopathy compared to no homeopathy. And also in this group, the results were an advantage of homeopathy. In the last study, which I have just submitted, it was just rejected from the Journal of Thoracic Oncology. I've sent it to British Medical Journal, and it was just rejected because it say, okay, we have too many submissions. It didn't say a concrete word. And now it's, I've just submitted it 2 days ago to the British Medical Journal Open, BMG Open. And I hope it will be accepted. You know, it's, but it's usually, it says, also in my conventional papers, I usually had to submit it to several journals. And the fantastic results of this studies is in patients suffering from non-small lung cancer, non-small cell lung cancer. Survival was higher in the group with homeopathy, and also quality of life was better. The only limitation is in the meantime, also those patients who had no mutation now receive immuno-oncologic therapy. So the survival is also better with conventional therapy. But anyway, this study proves that homeopathy is effective, whether or not you get the immuno-oncologic therapy, which is very expensive. And I don't believe that all countries of the world are able to finance the very, very expensive immuno-oncologic therapy. So I'm still interested to perform studies, and I am now out of the hospital. I'm interested to support anyone with the background of studies, because I am the strange man working with homeopathy and also at the university. And the requirements for performing a study is now very high. And there's so many pitfalls, and of course I'm not the man who knows all the pitfalls, but I know some of them, so I could support you when you need it.
May I ask a question at this point? Is it allowed?
Yeah, of course, of course.
You know, I'm really happy to hear of your studies, etc., and very gratifying. But you know, despite so many such studies as yours and so many other people, there is always the statement from, you know, scientists or whoever, you know, whatever they are, that there is no proof for the action of homeopathy, that all the studies that have been done so far are not valid. How does one counter this kind of statement?
You know, I had a discussion with the German skeptic Dr. Aust. He is interestingly an engineer, but after his retirement, he now works against homeopathy. And he had a lot of questions, and together with a statistician at this time, I was able to counteract all these questions. There was no question at the end which could not be answered. Now the problem is, any study done can be destroyed. Any study, all over the world, in every discipline, because there could always be bias, there could always be a confounding factor which has not been kept in mind. And there's always something which could be, and you can destroy any study. Now, our problem is that I believe, that's in my suggestion, we are too successful, and this makes some people very nervous. And so they put a lot of energy, maybe also money, I don't know, but I think many of the skeptics are really convinced they're doing something very good, and they don't listen to the good things. Like the the first Australian study, which say we have never stated that homeopathy is ineffective. So I was trained in school, if you say a double negation, it's a positive answer at the end, because they say we've never said, I don't know any exact words, but something like this, we've never stated that homeopathy is ineffective. So the problem is mainly the understanding, and people are not able to accept that something will work even without or with molecules, whatever now, maybe with nanoparticles, without nanoparticles. I think this is something more for chemical specialists. But I think at least with these studies, you can say, okay, we are doing a lot. We can't do more because we have almost no support. No one of my studies was supported by a homeopathic pharmaceutical industry. Just with the last one, I got some support for the statistical evaluation. Now I had some echo in my, but now it's gone.
It's gone.
So you are completely right. I personally, I think like you, one patient, one result, and this is science. But today, if you say in my experience, this means you are an idiot because your experience is nothing. It's not supported by any data. So first to come into contact and to communicate with conventional people, I think it makes sense to continue performing studies. Also, if you look to the study of Emma Cortes from Mexico with the menopausal depressions, it was just recently retracted, I don't know the word, after 3 years or so, because there was a lot of criticism, but HR and some others were able to combat this criticism. But the main problem, in my eyes, I think, is we have no money to convince anyone. I think it's like Al Capone said, you can convince someone with a smile, but it's much better to have a smile, and he used a pistol or something like this, but if you have some money in your pocket, because I think if you look to Germany, Austria, I believe also Switzerland, the numbers of patients using homeopathy being positive for homeopathy is very high. I think it's 60, 70, 80%. But I think India is land number one because you have the country number one, because you have established a special ministry for 5 complementary methods, and this is unique. So, and it's also unique that the Swiss people have voted for homeopathy and for some other complementary methods. But in Austria, in the moment, and I think also in Germany, we have no public support or no political support to get such an influence. So I hope one day the Ministry of Ayush will also be established in the European Union, or at least in some of the countries of the European Union.
I would like to bring maybe another point in the discussion. I do agree with what Rajan said, and also Michael, what you said, absolutely. And I think studies are important. We also conducted studies, for example, on paraplegic with recurrent urinary infection, and had also very good result. But I think we should maybe think that we will not make the study convincing the world of the usefulness of homeopathy, otherwise it would already have happened. Maybe we have to accept that we have to apply one of the main rule of the healing rule of homeopathy and of nature. It is to go from inside out, and to always think what is our intention in making this study. I think that if our intention is to prove that it's working, it's not going to work. Also, the result, the long-term result of our studies will not be so positive as we expected, even if the outcome, the scientific outcome, is very positive. If our intention is clearly to strengthen ourselves, it means that we have so much to learn as homeopaths, no? So that we want to learn more, and the main intention should be that patients should profit more. If we put the patient in the center of our intention and not our ego, we want to prove that we are also somebody, then I think that it is maybe another way. It has to do with the setting of which kind of project we support. No, that we go up to. I think that Professor Frass, that you saw it probably always when you made your setting, you always thought that the homeopathic rules should be maintained as much as possible. So, and not make, let's say, not make studies which we know are not homeopathic, just to prove it. So this would be my point, to think, also with COVID, also with other points, we should put the patients in front of it and not think that in the center, not in front, in the center, and not think that we will prove. If the problem is, I think, my husband always said, you know, homeopathy is much more accepted in India, because for an Indian to believe in spirit is natural. It is not natural in the Western world to believe in non-material stuff. From the moment that we cannot smell, we cannot see, we cannot touch, it doesn't exist for a majority of the people. So there is also this basic difference between both of it. And homeopathy being a dynamic, believing in dynamics, being in dynamic medicine, yeah, and this we have to accept. We have to accept that, but we have to continue to strengthen ourselves, to conduct studies, to help people, and this will lead ultimately in whatever has to be. So this was my point.
I guess from the beginning of homeopathy, we had to struggle that the allopathic medicine did not include the spirit or the divine, whereas homeopathy always did.
It is so. It is so.
If I may add a little bit to what you said.
Sure.
While keeping the patient in the center, and that is absolutely correct. But you see, the issue of proving whether homeopathy works, I do believe is equally important. And the reason for that is that if we want to reach the benefit of homeopathy to more and more people across the world, number one, and number two, if we want to see that more and more young people come into homeopathy as professionals, then they require a scientific validation. Because right now, if you open Wikipedia and read about homeopathy, I think you and I will also give up practicing homeopathy. Because it says that we are just nothing, we are nonsense, we are quacks. And Wikipedia is believed by a lot of people as true. So therefore, unless we have scientifically acceptable trials and such proof, a lot of patients will be dissuaded from taking homeopathy in the Western world. And also a lot of young students and practitioners and medical doctors will not like to adopt homeopathy as a profession because they believe it is nothing. This is the one point I wanted to make. And the second, as far as India is concerned, I would like to make one point in addition to what you said. And of course, you know, the belief in the spirit, etc., etc. But there is one more issue that is very unique to India as opposed to the Western world. And that is the idea that 2 points of view can both be right. It doesn't mean that if you are right, I am wrong.
Yes.
Or if I am right, you are wrong. This opposition, because India accepts diverse cultures, languages, and religions as a part of its ethos. And there is generally not too much conflict. So therefore, I found that in India, the openness of the medical profession to homeopathy is many times more than in the Western world. The division and the opposition is not so pronounced. Even, for example, in this COVID current pandemic, I can tell you a large number of modern medical doctors are taking homeopathic prophylaxis. I know it because I give so many of them. And they are so open because they say, we don't have a vaccine, we don't have prophylaxis. If you have something, we are happy to take it. And when they see its effectiveness, they appreciate it. You see? So this openness is good in India. And what I want to add is that probably one of the ways in which we can establish our validity is if we do joint research with the modern medical fraternity who are open-minded. When we do it in their hospitals and with people who are not homeopaths also, who are definitely totally, modern medical doctors, but with the attitude that we are willing to work and see whether, there is effectiveness or not. And if these people become the investigators, in fact, even the principal investigators, then that kind of paper will have much more, weight and value compared to a homeopath producing a paper and saying, look, homeopathy is effective. So this is my suggestion. And therefore, I'm really looking for hospitals and modern medical practitioners, even skeptics. I don't even mind skeptics, even open-minded people and skeptics, but who are willing to see, not people who are opposing, but who are willing to see, even with a doubtful attitude. And we are so confident about what we are doing that we can go right into, where they are and demonstrate the effectiveness of homeopathy in conditions that they laid down, the endpoints that they lay down, and let them only investigate. We'll simply prescribe. This is my thought. Maybe it is too simplistic, but I always believe and have faith in the goodness of all people, that there is something good in everybody. And if we can stimulate that and say, and go with a very humble attitude, listen, I would like to see, and I would, if it's not effective, I am willing to accept also. But can you accept if you see the effectiveness? So like this.
Yeah, I do understand. And I think this would be a wonderful idea. My point was just, there are a lot of very good studies already now, and they did not lead to the scientific acceptance of homeopathy. So this was my only point, but that we should continue, that we should work together, and we should work, I think, also like this described yet in the project in Vienna, or like we did in Switzerland, homeopathy in allopathic hospital as adjuvant therapy. So they get the normal medical treatment plus homeopathy versus the group just with traditional medicine. This I do agree absolutely. We have nothing to fear. We have nothing to hide, because it's not to us that we have to prove that it's working. I do understand that, and I hope that we'll find open-minded people who are ready to make such studies.
I am completely on the same page with you when you say that we should work also on research to improve our own, science and our understanding, and getting even better results with homeopathy. This is for sure. And definitely this work is going on all over the world. We are working on new remedies, new software, new ideas, new case-taking techniques, and we are potentizing ourselves in some sense. We are going to higher potencies. But my fear is that given the vicious attack by Western media and the very bad publicity that homeopathy is getting, that the number of practitioners is coming down very rapidly, even though homeopathy still remains popular in many places, but the number of practitioners is going down. And I worry for homeopathy itself, you know,
Sure.
not for its effectiveness, but even for its existence. And I think it's important for its existence that we who are right now, you know, in the responsible positions should do our utmost best to produce scientifically acceptable research data that support the idea that homeopathy is effective, and especially if it is done in medical hospitals under the very supervision of medical doctors, then I think we have a very good you know, basis of validating the science itself. We are sure, but you know, we want yeah. And as the professor said, that any research can be, you know, trashed and you know, finished, but at the same time, if we keep producing a volume of such things, then at a point it's going to be difficult to deny every one of them and say, no, this is not true, that is not true, that is not true. That is going to be, we're going to make it difficult for them, especially when done in cooperation with medical doctors. I'm sorry if I'm talking too much.
You're not talking too much. I just wanted to give Armin a voice as our out-of-the-box thinker, if he has any ideas listening to all our famous homeopaths talking here.
Yes, in my opinion, I think that we must build a bridge. Yes, a bridge between homeopathy and the pharmaceutical industry. Yeah, but the pharmaceutical industry is very, very strong. Yes, this was always since Descartes. Yes, that there was always a fight between the traditional medical treatment and the homeopathy. So now the pandemic with the coronavirus, I think it could have a change, yeah, because everybody has fear of his life. Yes, and there are two ways also now. There's the economy on the one side, and there's the health on the other side. Yes, and I think we should not think there's a health or economy. We must bring both together. Yes, and this is the question: how can we limit the fear of the pharmaceutical industry that they will reduce their wins? Yes, because they make a lot of money now with this virus. Yes, and so they can strengthen their position. And it's always a position of power. Yeah, they want to have a power. Also, the politicians, if they show results, it's always easier to show results if we react. Yes, but we must measure something. Perhaps we can make empirical studies. We can make more studies. We must find alternative hospitals. Yes, who wants to cooperate? Not only one or two. We must find many. So we must make a mind change. Yeah, also in the Western world. In the Western world now, there's also a mind change because they think, what's more important, the health or the economy? Yes, this will happen also in the United States. I think this will happen in India too, in Brazil. You know, all the world is now nearly locked down. Yes, and one can't see the results up to now, and it's a question of the consciousness also. Yes, it's a question whether you think only you must heal your body or you must heal your whole system. In my world, the human being is a whole system of energy. Yes, and here we can influence everything in this world of the energy. And the homeopathy is one way, yes, to strengthen the immune system. Yes, and also perhaps that we can react. And the next step, I think, should be to limit the fear of the pharmaceutical industry. Yeah? And perhaps also to find politicians worldwide who are open yes, who are open because the human being, they need it. They want to be proactive, not only reactive. Yes, and if we're always late, one can say we are late, then there will be then there's a damage. Yeah, and this time now, I think Corona could also be a chance, could be a big chance for a change of the consciousness. Yes, this is my opinion, but we must go step by step. Yes, because the fear is the most important thing. The fear of the human being, the fear you can make money. This is important. Yes, this the politicians knows, this the pharmaceutical industry knows, and so we must limit the fear of the people. Yeah, if the fear goes away, it's limited. And this is, and when does fear disappear? Fear disappears if you have alternative solutions. As more solutions you have, as lower the fear will be, in my opinion. Because if you have a solution or a probable solution, at the moment, also the pharmaceutical industry, they are searching, make a lot of researches to find something against the virus, but they don't have, it will take years probably, like in the AIDS virus or something. And so it's a chance to bring the homeopathy forward. Yeah, but there must be many mind changes. Yes, not only in the Indian world, also in the Chinese world, in the Western world, like in Germany, Austria, Switzerland, more and more people, they think in alternative medicine. Yes, because it's not only the medical thing at the moment what will change, in my opinion. Yes, it's because the whole world could be changed, but step by step. Yes, we are unique. Every human being is unique, but we are all united. Yes, and we are whole. And so at the moment there's an age of fear, because of this pandemic. And if there's so we must limit this fear. Yes, and here we have a lot of specialists. Yes, perhaps I can help with my network. Yes, I invited some people also to listen. And so everybody should take a small contribution. Yes, and it would be great if you can support Rajan or Michael. Yes, and also the lady from Switzerland. Yes, and there are so many that we can bring together. And there are so many alternative experiments, also in self-healing, but the people think this is nonsense. Yes, there could be also whether we can influence the cellular, the DNA, whether it's possible to strengthen the immune system. Everything, in my opinion, could be possible. And as more and more people, as more trial we make, it should go on one direction, and we must find supporters who are thinking outside of the box. Yes, because otherwise there will be no change. Yeah? There will be no better results. And the results will stay the same. Yeah? If we are doing always the same, the results will stay the same. But if you think outside what we can add, yes, so it could happen. This would be my wish, yes, that the medicine, yeah, also the view will change in a global system. Yeah? Not only the school medical system, also the alternative medicine, everything. Yes, and at the moment, everybody wants to protect his reputation. Yeah, and also if they have no solution, they want to protect the reputation. It's an ego. Yeah, it's the ego of many famous researchers, of many famous professors, it's clear they have fear to lose their reputation. Yes?
Neil, you wanted to say something?
Yeah, look, it's fascinating to hear what everybody's saying, and I'm pulling different elements out of what's being said here. And if I think here in Australia, there is absolutely no way that homeopathy would be allowed in a clinical trial on its own, because that would be considered to be unethical for that to occur. However, there is a model in existence for nearly 20 years here in Australia, or in Western Australia anyway, for cancer patients. And this alternative model is that they have Reiki practitioners, the energy, the hand energy healing. And they have been, it was very tentative when it first started, but I spoke recently with a professor of medicine at the hospital where they do all of the very intensive chemotherapy work and radiotherapy work for cancer. And with these patients, they said there's no way that we're going to get rid of the Reiki. The Reiki is just so important to the treatment. Now, the Reiki was never proposed as an alternative to the actual treatment. It was seen as complementary. So it sat alongside and supported the chemotherapy and the radiotherapy work, that was going on in the hospital. And so there's no intention to do what we're fearing. So what we're fearing at the moment is that what's proposed with the homeopathy is that it's a competition to the allopathy. That's what we're all sharing is that fear that we're seen as being, a competition, that we're actually trying to beat them. We're trying to beat them down or destroy them or control them or something like this. And the moment you go in with that energy, so, I love the conversation earlier there about what is our intention, what is our energy around these things. If we're able to do the sort of test, Rajan, that you were talking about, where the double blind aspect is just literally whether the, so the person's already getting the intubation or whatever, mechanisms are required, that all you're doing is you're double blinding the support. And there's no, so the allopathic medicine isn't even a part of the trial. It doesn't form a part of the trial because it's just a constant. The allopathic is a constant, and we're not trying to actually compete with it. What we're doing is supplementing it. I see that as being, a possibility, but in a country like Australia, there's absolutely no possibility that we would be able to do clinical trials where there was no allopathic support in place. That just would not exist. So that was the, one of the things that I was, just observing from what's being talked about here. The interesting thing is that the experience in these Western Australian hospitals with using the Reiki has been so dominant and so powerful that they're extending it out of the cancer wards. It's now being used in other wards in the hospital as well. And they've just actually introduced sound healing, so that they have people going in and doing tone singing in the wards and playing with the crystal bowls and this type of thing, which 20 years ago would have been absolutely impossible. And they have team meetings, and the sound healer and the Reiki healer and the cancer therapist are all together, working with the patients, and everybody's got a voice at the table, everybody's respected. There would be an opportunity in that type of setting to use homeopathy under that type of premise. And so the double blind aspect, can be managed. There is an ethical issue remaining in there as a homeopath, and I'm not sure, Rajan, or how you actually manage this, that the idea of actually denying a person the treatment when the feeling is, the intention is that would be harmful to them. I don't know how you manage that. And, perhaps the three of you medical people could talk about it. It's easier for me because I work with psychology. So it's a different matter. But anyway, thank you for listening for my long talk. But yeah, those are my thoughts.
Martine?
I would like to bring one point, Neil. We made the same experience in Switzerland when we made our study on useful level of homeopathy in paraplegic patients with recurrent UTI infection, and the outcome was positive. And it led now to the acceptance in this clinic, in this paraplegic clinic, of homeopathy. And now we are treating paraplegic patients with recurrent UTI, of course, but with many other complaints, because the acceptance started from this point. This is definitely a working possibility. What we encountered as a problem there is that very soon amongst patients, because we were working with IPD patients, most of them, and also some OPD, the usefulness of homeopathy was clear. They were speaking between them, saying, "Well, I'm taking this homeopathy and it's working," you know. And so we got a lot of problem to get the group together, because people were saying, "I want to be sure that I'm getting homeopathy. I want to go directly to the homeopath. Because I don't want the classical way. I know it's not working well." So this is definitely a problem we did encounter, which led to the situation that our studies lasted longer till we had enough patients accepting the setting. Yeah.
The micro.
I suppose this was a study by Jürgen Panek in Switzerland.
Yes.
I have one question to Neil. Did I understand it correctly that it's also not possible to use additive homeopathy additively to complement to conventional medicine?
I think that would be acceptable, because the allopathic view is that the homeopathy will do nothing.
Because in my cancer study, we just did it additively. So the patient received the complete anti-cancer therapy. And in addition, they received either placebo or homeopathy.
Okay.
And similarly, it was done with the septic patients. So, of course, you cannot remove the patient from the respirator if he needs respiratory support.
Like from how I'm viewing it here, and like if we were to try to implement a program for you, Rajan, here in Australia, it would need to be along the lines of what Michael's talking about. It would have to be done in that way. And what I'm struggling with, and this may just be my misunderstanding about homeopathy, but it strikes me that the intention around homeopathy becomes complicating in the notion of a double-blind approach. That's what I'm trying to work with, and what I'm thinking about is the purity of, Rajan, you're talking about wanting to get your student numbers up and that type of thing. Well, that's around the purity of our intention, our purity of intention as educators and practitioners. That's a big question. This is an extremely big question, and I feel that it's in these questions that the answer to the need rests. This is my opinion anyway.
Maybe it's contradictory to a very good doctor to use double-blind studies, because we want to help each one. And we know if half of them gets the placebo, they won't get help. But for the Western point of view, from the scientific point of view, to fit in, we need those double-blind studies. But somehow, it was in myself always, this feeling that I have to give somebody a placebo and just keep them off the right therapy didn't feel good to me.
How do you manage to
look at it the other way around? If you hadn't gone into that hospital, they would not have got the treatment anyway. I mean, you're offering a study, at least half the people are getting the medicine. If you had not gone with the study, nobody would have got it. And of course, it is with the full knowledge and consent of the patient that he knows there's half the chance he will get placebo. And this is, I think, very important, for validation in future. And my thought is that once the study is completed, then you can give the other half also the remedy, you see. I mean, they will benefit anyway. So I think this can be a viable alternative, and I am fully accepting of the idea that homeopathy can be tried as a complementary therapy rather than as a standalone in the beginning. You see, so once you are convinced of its effectiveness, then you might want to try it also as a standalone, especially in cases where modern medicine does not have any kind of solution, where you don't have a treatment. You can start with this. For example, right now, when there are COVID positive cases which are asymptomatic, no treatment is given at all. It's only quarantine and, like this. So why not we start with those people? What do you lose? So you take 100 quarantined COVID positive cases, give them homeopathy, take 100 positive quarantine cases and give placebo, and see in what is the average time for the reversal of the positive to negative, what is the rate of development of symptoms and complications, etc. in the two groups. And anyway, you're not offering any treatment at all. So this would be the easiest thing to do.
So could we manage to find a hospital that would agree to that?
Yeah. In Germany now, I think the politicians are very convinced about what they are talking about because of the results with the COVID patients. Yeah, the death rate is very, very low in Germany. Yeah, so they say our medical system in Germany is one of the best in the world. Yes, I think it's nearly the same in Switzerland. Yes, and in Austria too. And so we must really think outside of the box. Yes, there's one hospital in Germany. It's in Greiz, but now Greiz is a hotspot also of the COVID patients in Germany. Yes, there's a hospital called Klinik im Leben, hospital in life. Yes, and the chief of this hospital, Dr. Reuter, I don't know whether Michael from Austria knows him. He also made a lot of experiments with cancer patients, and he tries to combine, yes, the pharmaceutical things and also the homeopathy. Yes, he was also a speaker years ago on the Bleep Congress on what the Bleep do we know on this, what is secret movies and so. Yes, and yeah, the politicians, the Spahn, who is responsible for the health system in Germany, yes, he thinks very restrictive, I think, in this field, and so we must go other ways. Yes, also always make a lot of. At first, we must do something for the spirit of the people, that there's a possibility to change. Yes, if there's a spirit where they feel comfortable, yes, then perhaps they will change step by step, or they will be open to make a trial. Yes, and it's only at first we will be really a small group. Yes, because of the pharmaceutical industry. Yes, we must be very, very diplomatic. Yes, so that they don't see the homeopathy as an enemy. Yes, or as a competition. Yeah, this was always. It was always that this view since Descartes. Yes, that there's a scissor And there is a Caesar, and I think we must think that, and we must make an that there's no either or. Yes, there's also homeopathy and the traditional medicine, and this perhaps we must find the best way to combine it. Yes, and here people who are open. Yes, clinical, and then we also this hospital who is open to make the trial. Yeah, they must. It must have a lot of courage. Yes, because of the pharmaceutical industry. So. So this is the way. So how can we support in this hospital? Yes, because there must be a lot of courage. Yes, because they go against the system, yeah, in the Western world, and the system is still the health system. And here the people are proud. Yeah, they are proud that they have good results. Yeah, but it's always the next step. Yes, perhaps because of the situation worldwide now, the people are willing to change a little bit. They are open to discuss. Everyone see it now. They are open to discuss. Everybody wants to have secure informations. Yeah, not only what's the probability. Also, in my opinion, the test results, the figures. I studied empirical research, so I did a lot of statistics. One can see that many of these figures that they show, they are not valid, in my opinion. Yes, they are not valid because the death rate you can influence by statistics. Yeah, this is what many are doing, because it's a big difference. Yes, if you make a trial with a COVID patient who is nearly wider, yes, who has more symptoms, as a COVID patient who starts, yeah, really with the symptoms. Yes, and so the politicians, so they can interpret like they want. This is a big problem, in my opinion.
Yes, the statistics are a big problem. And I tried to listen to your idea of being diplomatic. And I know, Rajan, that you did a lot of treatment with ragas and proving with ragas.
Yes.
And you use all the homeopathic thinking with the ragas. So maybe it could be an entry point, treating with ragas first, and then second phase, once you're in hospitals, go there for testing with homeopathy.
Yes, we are happy with any kind of entry point, but you see, I don't know what treatment protocol for COVID is followed in Germany or other, but in India, a lot of hydroxychloroquine is being used.
Mm.
And now they say that hydroxychloroquine has proved to be statistically not effective. I just read in today's paper,
Mm-hmm.
and so you are giving a remedy that is not fully tried and tested, and in fact has been proved to be ineffective, and you are pushing it into a large number of people as a standard protocol.
Yes.
So, I mean, there seems to be a kind of ambiguity or duplicity of, you are giving something that is totally untried, but when somebody is saying, here I have, a basis for trying something, why don't you try that and give it a fair shot? And if you think that homeopathy is placebo, then there is absolutely more reason to try it, because there is no harm done. What did you lose by giving 50 people placebo? You lost nothing. But the upside can be a tremendous potential for human health. And what I would like to add to this is that in India, our experience with many, many modern medical doctors and the way we work with the medical fraternity is very much in sync. There is no, we we respect them, and we, continue many, many times in many cases, for example, hypertension, diabetes, or asthma or whatever, we continue what they give and we add the homeopathy to it. And only when the patient starts to show improvement, with the help and the guidance of the specialist, we taper down the dose gradually so that the patient is now free from both the medications, homeopathy and allopathy as well. Our idea is not to make the patient dependent on either. So this kind of sync is so much prevalent in India, and I really wish that this kind of thinking also permeates into Europe and Western society.
I totally understand that, and I'm absolutely on your side. The thing is, the economic thinking and the wanting to make money, and it's all about power and greed here. And maybe this is what Armin wanted to add, that we need to find people in hospitals, individuals that are stepping out of this power and greed scheme, and from their ethical point of view want to cooperate. And maybe
Well, I may be
Armin,
very naive, but I still have somehow the faith in the essential goodness of the human being. I've still not lost that trust. And
yes,
I think deep within all of us are good people, and they are motivated by higher purposes than making money or power. And we have to appeal to this goodness with all the good intention in our heart and say that really, as somebody said, you said very nicely, you said that we don't have to stop what they are doing, let them continue, just have a placebo group and have a homeopathic group, have it double blind or random control or open label or whatever protocol you want to adopt. But it doesn't take time, especially in COVID. It's a short lasting illness. You can find the results very quickly, either way. And we are so confident that it will work. And we have data from all across the world of thousands of people of COVID treated in so many countries and used as a preventive. Now, the Indian government is giving homeopathy as a preventive to almost the entire population. The Cuban government is giving homeopathy as a preventive. In Brazil, whole cities, homeopathy is given as a preventive. No, you don't have to trust it. You don't have to believe it. You simply have to try it. And there is no downside to trying it because anyway, it has no side effects. And within 2 weeks, within 2 months, you will know the result. What do you lose? Be open because this is for humanity. It is for you only. You see, it's for you. It's not for anybody else. This is my appeal.
yes, I understand it. Armin, could you make contact to this hospital you talked about, Klinik des
Yes,
Lebens, and see whether you can contact the director of that clinic and
yes, sir.
directly ask him whether he would be prepared to do just a test with Rajan and make
Yes,
the contact.
this I can make. Yes, and perhaps it would also be good if Rajan has the studies, also empirical data, yeah, the statistics, what he found out. Yes, as more data as we have, yes, perhaps we can also influence the net a little bit, yes, so that the population will be more open, yes, and as more people will be open, yes, and there are many online congresses now, yes, like this summit, or then Mind Changer Summit, which will be in 7 languages all around the world, because now it's time that the people can see that they are more, that they are only the body. Yes, they have a spirit. Yes, and yes, and this is the most important thing, that they find out that we have a spirit, yes, and that we can heal together with new solutions, yes, and to be proactive, yes.
Yes, this is why
And
I asked you to make contact to maybe the politicians or the clinic that you know personally.
yeah, to
And
declare.
I'm sure that Professor Dr. Frass will help you with whatever studies he has.
Yes, as more studies we have, yes, as more the spiral will be, as more energy will be, as more we must combine the empirical data, the mind, yeah, with things that are not proved. When they would argue that these methods are not proved. Yes, this was
But
always
want to prove them.
exactly. Yes, and that's the reason why we must be, yeah, as I told, diplomatic. Yes, but we can. And then it's a question also of marketing. Yes, that if we have success with the studies, yeah, then we must influence the internet, yes, with the studies, yes, because then more and more people will be aware of the studies. Yeah, this is because at the moment the people are unsecure worldwide. The people, they don't know the direction what will be. Yes, and that's also the politicians at the moment. They are very, very diplomatic. Yes, on the first side they protect the health, but now they got pressure from the economy. Every world will be the same. Yeah, and one country is earlier, one is later. Yeah, and so it is also like a kind of scheduling. Yes, so if we can, we must give them alternative solutions. Yes, and the best will be if we can give them results as fast as possible. Yes.
We could give them results if they would allow to test us.
Yes.
This is the thing. And as Professor Dr. Frass said, he already proved that it is a lot cheaper than any conventional method. So we need just one hospital or two hospitals to cooperate to get the next results. And Neil, could you ask a clinic in Australia?
Absolutely. On the basis of what we're talking about, I can make approaches as well. And as Armin is saying, if we were to have in our hands what we would consider to be marketing material, which is the studies that have gone before, then that would really help. So it's I don't mean to denigrate the wonderful scientific work that you're doing, but to us it's actually marketing material. It's a way of influencing, and the barrier, like the resistance barrier, when I approach the clinic, is they say don't waste my time. I'm too busy already. And so
we would need good marketing material. This is the point you can make.
That's well, and the marketing material is the scientific studies. That is the marketing material, and particularly with the statistical material. And then the argument is you can't lose anything by doing this. You can't lose anything by trying it. But think of what you might be losing by not trying it. And here's some statistical evidence for it. It's not going to cost you anything. You're not going to lose any reputation. None of those negative things will occur to you if you try this. But look at what could be. And what could be is the marketing material. It's the studies that you've actually had. Now, Rajan, I'm very aware that part of this intention about the natural goodness of the human, that shouldn't be forgotten either. So, like, we've got the intention of homeopathy, we've got the intentions around the natural goodness, and so when we're approaching people, we are approaching and appealing to their natural goodness with the fear removed. So we remove the fear by saying you can't lose by trying this. There's no way of you losing here. there's only a possibility of great opportunity. Simon, I can see that working, you know. I can see it working.
If it might help you or Armin, I could send you a draft for a study.
Mm-hmm.
And this the main problem is it has to be adjusted by a statistician. But I think at least you have a body in which you can work and operate. And I think this is something which you could show to your colleagues or to colleagues at the hospital.
Yeah, this would help. Yes, and perhaps we can find hospitals also like in hotspots. Yes, this would be great. For example, in Brazil, yes, in the United States, one in Russia, one in Italy also, one in Great Britain. Yes, and this would be great. Yes, because here these are in Spain and France. Yes, there's more hospitals we can find. Yes. And then we can compare perhaps the results of the traditional COVID patients, you know, and with homeopathy. Yes, because the politicians, they will react if they see results. Yes, this is they want to see because they have panic, and then they want to secure their power. Yeah, everybody wants to be re-elected. Yes, also in Germany, there's a fight between the countries in Germany. Yes, the Bavarians, we are following the Austrians. Yes, and always with a time delay. Yes, because it was working in Austria, and this is it. It's dynamic. Yes, if we and if we can use this dynamic, you know, also in the tests, then one hospital, then the next hospital, the next, and this would be the best.
I would just also bring one point. I do agree, Armin, it would be great if we get many hospitals, because obviously the amount of people, the data and everything gets more interesting. But we have to be very careful who is going to, if we can manage that, who is going to prescribe the homeopathic medicine, because this is very important that we have only highly experienced, really, people doing it. And there is a slight difference in the model with where we make a non-homeopathic concept, where we prescribe everybody the same, then everybody can do this. But from the moment, and I guess, Rajan, this is what you are thinking about, is doing actually classical homeopathy in these cases, because the experience till now shows that there are many different, there are not only obviously one medicine which works. There are main medicines, but not only one. And so we need homeopaths, very well-versed homeopaths in the clinical setting prescribing. And this is going to be not so easy to realize.
No, I think there may be a solution.
Okay.
I think in this lifetime, up to the end of the third of this century, it will not be possible to have homeopaths in a high concentration at ICUs or somewhere else. But what we could do, and I do it with several patients who are critically ill, I work together usually with the wife, yes, and she sends me also details. I'm still doing this now with a patient who just by chance he had a COVID, but now it's difficult to send him remedies because he's in a hospital where it is not allowed to send anything. But what you could do, if there's a person interested in homeopathy, but not being a homeopath, you just make a telephone interview every day. At the pharmacy, you have a source of, let's say, 100 remedies. You cannot have all 8,000 remedies, it's impossible, but maybe 50 to 100 remedies which are suggested to be helpful in COVID cases. And of course, the pharmacy has a bottle with placebo. So after you have given the information which remedies a patient should get in which dosage, the colleague who has talked to you on the phone now sends information either via fax or email to his pharmacy of the hospital. And now at the pharmacy, they have a randomizer, and they put in the age and sex and the number of pre-existing diseases, for example. And then the randomizer gives the pharmacist information whether homeopathy or placebo. And now the pharmacy of the hospital sends a remedy to the ward or to the intensive care unit. I think this is easily possible, and I almost never see the patient, and now it's almost impossible because in Austria you're not allowed to enter a hospital where there are corona cases. At the moment, it's I wanted to join my wife for an examination, and they said no, you're not a patient, so you have to stay outside. And so it's relatively easy. And I think there are two groups which could be investigated. One is elder or older patients with pre-existing illnesses, and the other group are critically ill patients. So I think we could make a study with one of the two, and this is something which has to be decided by you or by the colleague of the hospital. In Austria, if someone has been tested positive for corona, he's not sent to the hospital primarily, unless he's in an unstable condition, but he's sent home. So it's another situation. But personally, I have not treated one COVID case so far because they don't come to my office, and I was not contacted for it. But I think this is possible, and this is also manageable with let's say 50 to 100 remedies sitting in the hospital. And they just, you have to decide, of course, you give high potencies or low potencies, whatever, maybe it's a 200 bottle, but not too many. I think anything which is too complicated will not work.
I do agree, but I think this is quite a pity because we know very well we could help much better if we can see the patient, if we can observe the patient. And or having somebody knowing homeopathy observing the patient, this would be would be at least the ideal point. But I do agree. I do agree that your idea is probably more realistic one, but suboptimum.
Yes, but if you do it after some while, I think you find out because you ask the colleague, is he sweating? Does he have diarrhea? Whatever. In addition, of course, with critically ill patients, the problem is you have a lot of reactions which may be possible to conventional treatment. So it's difficult to find out the difference. But this is something you are as a trained homeopath, I think you know it. But I think it is possible because I do it also. Well, for example, years ago, a patient was referred to the intensive care and he was on the respirator, so I couldn't talk to him. So a relative of him, he called me and said, what could we do? And I said, what has happened before? Do you know, was there some outstanding acute situation? And he said, yes, he's suffering from polyarthritis for many years. And he had just a situation where his joints were swollen, red and hot. So I said, okay. And he was suffering from pneumonia. It's a critical ill. So I said, okay, give him Bryonia. So he gave him Bryonia alba and he improved very much. Then he needed some other remedies. But just, I think we are used to rely on good observers. And if there's a colleague, he or she, and maybe the best is, I have the best results with nurses. Usually better than with doctors. With study on COPD patients, I usually rely on what the nurse is observing because the doctor does not know whether the tracheal secretion, which color is this, or whether it's profuse, or whether it's thick or thin. So I think the nurses are usually like the wife of a patient is usually better than the doctor himself or herself.
Well, my suggestion is to take the patient's cases on the telephone also.
You know,
can
of
get
course,
directly.
I agree. It's better if you see the patient, but otherwise, if I'm in this environment, sometimes I'm a little bit distracted because there's so many noise and things like this. Also, I've worked here for 20 years, but I'm much more relaxed when I'm sitting at home and talking to someone. And for me, it's even easier, I would say.
Okay.
So,
And definitely, you see, I have a lot of colleagues in Germany, and you can, you know, activate them, and they are good homeopaths. So we can form a team, and I am very happy to guide all of them also, so that we can give the best possible results.
I think also maybe, you know, I don't know how much, I mean, who has, or if somebody has a lead in, I think, Armin, you said this, in evaluating the data as we have now, the empirical data as you have now. Rajan, you said we have many, many cases that have been compiled from different homeopathic associations worldwide, you know, because I'm fearing, I'm not fearing, I'm very happy about it, but I'm asking myself if we are not maybe possibly running out of time, because it will depend. If I see the situation in Switzerland, we are definitely running out of time. Fortunately, the cases are getting very less by the day, and so the possibility to conduct such studies will be very, very small. No, but I'm coming back to what Neil said. We can very well use this this whole crisis and this, which is also a big chance for a change. We can use it maybe if we have this this empirical data showing the public that there is very well an alternative, which is a risk-free alternative, because they don't have anything to lose. So with this kind of message, why don't we try to move on both sides, not only concentrate ourselves only on the scientific studies, but trying really to move on the other side, to change the mind of the people, which ultimately will be the source of strengthening homeopathy. Homeopathy has to be wanted by people. That's what was said from somebody. Switzerland, Germany, Austria, I don't know, but 60 to 70% of the population want homeopathy. So we have to continue on this line worldwide. This would be my suggestion. But Rajan, can you say something about that? Are you informed about, is there any efforts to consolidate all this empirical information we are getting, all these cases, which?
Well, yes, there are many groups of homeopaths who are trying to do that. I am in touch with, you know, the president of the International Homeopathic Medical League, Liga. His name is Dr. Cataldi. He's from Argentina. So they have set up a whole committee to collate all the data. I know that my friend Jeremy Sher is also collecting a large number of cases. And in India also we are collecting these cases. But I'm afraid that, you know, we don't have controlled studies. And this is going to be a problem, because whatever we do, I'm not a research person, so I cannot say this for sure. But my simple logic tells me that you know, all this will be considered as anecdotal evidence without a control, and therefore not valid. This is what I'm afraid of. I do believe that controlled studies is probably the only, you know, gold standard which can be accepted. This is my feeling, but I'm not a research person.
I think there are two lines. I do agree with you with the control studies, but I do agree that anecdotal evidence, as you said, is very important to create a conscience in the public, because it is much more emotional for somebody to read a case or to hear about simple evidence for the public than to hear about the study. So I don't think that both ways are contradicting themselves. I think both approaches are complementing themselves. But maybe Neil, you can tell us something to this. What you know what because from what I understood what you said that the conscience of the people through information is very important, so they are ready for this therapy. That's what happened in Australia, no?
Absolutely. So in the example of the Reiki, which is, you know, like it's far harder to prove, the you know, the evidence of it is far harder to prove, and yet it's been so extremely successful, and the patients demand it. So when the patients are in the hospital, they know of all of the clinical evidence and it's all talked about, and the patients are demanding it. When are the Reiki practitioners coming? When can they come to see me? And this is from the weight of evidence. It's not from double-blind evidence. It's from what you would call, you know, Rajan, it's anecdotal evidence. It's nobody's thinking that it's scientific, but it's what we want. This is, we the people, this is what we want. And I think this is really, you know, very critical. And, you know, we're in this time at the moment where the idea that we can only accept what the doctor is giving us is diminishing. You know, that's a change. And Armin, you were talking about before, that is a big change that's going on at the moment. And so however it is that's appealing to the patients, this is where we approach it.
Yeah.
Is there a website that collects all the data from all the homeopaths on the world, so that we have the anecdotal data and the studies and testimonials from clients? Is there a marketing material visible in the internet already? Did anybody set that up, Rajan?
Sorry, I didn't follow what you said.
I just was thinking about marketing material, and I was asked, is there a website where laymen and doctors can go on and see the evidence of COVID-19 treated clients with homeopathy, collecting the studies we have, collecting the anecdotal data, let's say we have, collecting testimonials of clients, just good marketing material for people to have a look?
I don't know if such, I know that the Liga Medicorum Homeopathica website lists the cases that have been collected from different parts of the world. But I'm not sure that data is fully clear or accessible, or, you know, to non-homeopaths. So basically they collected in terms of which remedies helped, etc. But I'm not sure whether they put the exact results and, you know, what happened, etc. I'm not very sure about that, because their idea was simply to find out which are the most effective remedies. So they have listed the cases, but I'm not sure if the results have been correctly tabulated.
But I think for what we talked about today, having marketing material for clinics and allopaths to look on, a website like that would be a good thing.
I agree with you. I fully agree with you, but I don't know who is going to do that.
Okay, so we need to find someone. Could be possible.
And I think this basic principle applies out to you know, many other approaches. You know, like it's, I'm thinking, you know, how is the, like this incredible model that we've got running here in Western Australia for Reiki, how is that being promoted out to the rest of the world? How are they gathering data? And my suspicion is that it's even worse than the amount of data that you're collecting, Rajan, or that homeopaths are collecting. So, you know, going forward from here, like the biggest message for me is to start actually gathering this information properly, to actually do that. Just exactly that question that you asked, Marianne, it's identical to what we need to be doing. So
and to make it visible
and have it be visible. Have it be visible. I agree. So this would be something that I would like to, put my energy into as well. And I just wanted to go back to the point earlier made about, are we running out of time with the COVID? And we don't know. Like there's
we don't know.
There's no proper epidemiological modelling at all going on. There's all kinds of modelling, obviously, but there's not anything that anybody really has any confidence in. And so, that time is not helpful. It's not helpful in terms of Rajan, what you're wanting to actually do for this particular COVID situation. However, the general principles of how do we actually get a body of evidence, anecdotal or not, just case study after case study evidence, that in itself is what needs to go forward. So I have a number of colleagues that I can approach on that topic as well. We almost really need to have a PhD student somewhere, make it a project to gather all this information and how to actually analyze it and so on. It's that type of thing, isn't it? It's just that sort of study that's required.
Mm-hmm.
And yes, for a director of a clinic, it would be nice to have a page to look on and see how are the clients reacting, how the patients reacting, how are their families reacting, and what are the studies we already have.
Mm-hmm.
Maybe this is the diplomatic point
Absolutely.
we could get.
I think that whatever happens, how the epidemic continues, I think it will have also an effect, no? Because it is what you said, Rajan. All this thing very well documented about the Spanish flu and all these other epidemics. They have still a very important evidence for us. So these are like two things we need to do. Definitely, and hopefully, I still hope, Rajan, you find something in India, because this would be definitely better than in the West from the amount of patients.
Yeah, I am making all the effort possible, and I hope that we can do something here, because here the number of cases is increasing day by day.
Yeah.
So definitely we are not running out of time here.
Okay,
So
good. Not good. Please.
Yeah, I'm trying to contact the right people and do the right things, and we have some support from governmental agencies also. So I'm trying my best. Yeah.
But if we have a good if Professor Frass, if you can make a good model and validate it, I mean that we have something which we can use. If Rajan, you find something in India, this would be already a good base, a good standard, no? A good base. And did I understand that there is a problem or that there would be a need of a statistician looking of what? Yeah.
Yes,
Do we have any resources amongst us?
We had a very, very nice statistician, but later on, the dean of our university, he more or less he forbid it to him. Let's say he was asked to not cooperate anymore with complementary medicine, and now I had to assess all the data of our study with an external statistician, but this costs money. It's a problem. So it's 100 or more euros per hour. And I spent a lot of money for the study for the statistician. I think there's one guy in Salzburg, he might be of help, but I have to find out. I don't remember his name at the moment, but I think he could be helpful. But we need someone who has experience with clinical studies, because there are so many pitfalls. No one is able to overlook all of them. And if something has not been taken in consideration, later on someone comes and says, okay, your study is not valid. So it's, I think it's also, he is also necessary to define the sample calculation. How many patients do you have to include in your study to have a benefit or to see a significant difference? And he also should define the statistical methods he or she will use. And also whether or not you're using stratification or which stratifications you're using, just like age and sex and previous illnesses, and so on. And maybe if, I think in this case, you cannot make an interim analysis, because usually if you have a study lasting for 1, 2, 3 years, you can say, okay, after 50% of the included patients, you make an interim analysis. And if the interim analysis shows positive results or just negative results, but significant results in one or other direction, you might stop the study. The problem is, if you have an interim analysis and you make later on the final analysis, you have to use the Bonferroni thing, which means you have to double the p found for significance, and the p should still be below 0.05. So I'm not very good in this. I'm just a clinician. I'm just a homeopath, but statistics is far from what I really understand. I just know you have to have one on your side who has really good experience. I think in India, I think it was perfect, because I think there's a study of James Michael with sleeping disorders. He must have had a very good statistician. And of course, also this study has been criticized, but as I say, there's no study which cannot be criticized. But maybe we could get help from India, because this statistician was obviously very, very good. I don't know.
Does anybody else know any very good volunteering statistic person?
I can make 1-2 calls in Switzerland. I'm not sure about it, can't promise, but I can make a few calls.
Maybe Jürgen Panik knows someone.
Yeah, that's what I mean. I'm gonna ask him. The one who worked with us previously. Maybe through this network we can find the right person also.
Or Klaus von Ammon, I think he will.
Yeah, yeah, absolutely. That's what I was thinking. Yeah. So this I can do.
Okay, so we have a few solutions. One is we need some communication material to the outside, good marketing material. The other thing is we need a statistic person. We need to have a look at all the pitfalls that the statistic can offer to us. And maybe, dear professor, you can help a bit on that.
Okay, but I'm not professor, I'm just Michael.
Okay.
I'm just old.
Okay, and yes, maybe we can go from there. And did anybody of you talk to Massimo Mangialavori? Rajan, did you talk to him? The Italian homeopath? Oh, you have your micro off.
I'm in touch with him on the email, and I've not spoken recently, but about, I think, 2-3 weeks ago.
Mm-hmm. Because maybe he can find a hospital too. Maybe. At least they have a lot of problems there.
Right.
And does anybody have connections to Russia and the hospital there?
Just several years ago, I was in St. Petersburg, but these meetings were organized by veterinarians. But I could imagine that they have connections to human doctors too.
Maybe you can go down that track?
Okay, I will travel to St. Petersburg because I like the Hermitage.
It's a nice country.
I can ask.
You can ask, okay. So I think we should close here to not use up too much time. Thank you everybody for this special talk. And I will transfer all the emails between you people so that you can stay in contact. And maybe, and I really hope we find a solution here.
Yes.
Thank you so much for organizing, and thanks everyone for your input.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.
Bye.
Bye.
Have a great day. Bye.
Bye.